When I went to medical school, I thought, oh, I'm gonna be a surgeon, or I'm gonna be a neurologist, or I'm gonna find the cure to multiple sclerosis. I had a lot of great ideas. And then I spent time on pediatrics, and very quickly, the children just won me over. So as a pediatrician, you can be a general pediatrician or you can be a subspecialist. I thought I would want to be a generalist at the beginning, but then infectious disease really got under my skin. And it's so interesting to try to figure out what infection is there, what's happening. And the other thing about infectious disease is it's changing all the time. We have new organisms, we have new antibiotics, we have new diagnostic tests. It's not static. So you're constantly learning, you're constantly trying to figure out how to do things better or how to do things differently. One of the most exciting times for me was when we had a child who came in with an infection in his knee. It turned out to be due to the pneumococcus, a not so unusual problem. And he did very well. We treated him with antibiotics. He got better. His knee was perfect. He was running around again. And then almost a year later, he came back with an infection in another joint, in his elbow. And again, it was that same bacteria. And we thought, now this is not right. This shouldn't be happening. And this was before we had a vaccine against the pneumococcus. So here we had a child who had 2 infections with the same organism, and we started to evaluate him to see what the problem was. And it turned out he didn't make antibody against the pneumococcus. So we said, okay, what can we do to protect him? We didn't have a vaccine at the time, so we said, all right, we're gonna put him on penicillin every day, just like we treat children with sickle cell disease, because we know they're at risk for this bacteria. He took that medicine, he was very good about taking it, and I didn't see him again for 15 years. Unfortunately, someone stopped the medicine, and he came back in within a few months, and he had a bacterial infection, meningitis, same organism, pneumococcus, around his brain. Again, he did phenomenally well. We treated him with antibiotics, he got better. At this point, we had vaccine, we vaccinated him, he still didn't make antibody. So now he's back on penicillin and doing well. It was a remarkable story, a very unusual problem, but one that we could eventually figure out and do something about.